Healthdot, an unobtrusive, simple-looking device that monitors heart rate and respiration rate, connects directly to the cloud, and allows patients to recover from the comfort of their own home. It has been launched here in the Netherlands in the end of February this year, 2021. The beauty of the Healthdot is precisely in its simplicity and unobtrusiveness. The patient, after a procedure in a hospital, such as a surgery, has the small Healthdot attached and can be monitored both in the hospital and continue at home. The patient doesn't have to do anything. They can completely focus on their recovery. It's a simple solution that has garnered a lot of attention. You see a few examples of that here, but it also includes awards from IDEO and Fast Company and has other media coverage. Many patients prefer to go home as soon as possible. For hospitals, it opens up opportunities to free hospital beds. For example, if a patient can safely go home one day earlier, or in times of a pandemic, less critical patients can be monitored safely from home and not come to the hospital at all. This really gives hospitals the ability to care for patients beyond the four walls of the hospital. Hi, I'm Jeroen Keizer, a senior usability designer from Philips Design. I'm proud to be part of the team that brought the Healthdot to market, a solution that is fundamentally based on a key usability insight, that patients recovering at home are not in a state to deal with any additional technical burden. They may be in serious pain, may not be able to concentrate, and are just trying to get back to their day-to-day life. But how did we get here? How did an idea that started in design develop into a venture that brought Healthdot to the market? I want to take you back to where it started with the original design brief. Philips Design was asked to develop a vision on connected sensing outside of the hospital. That's exactly what the design team did. They looked at different types of conditions that could potentially be taken care of at home and started to create a story and a vision of what is possible. But as they were coming up with this vision, something stuck out from the user research. When interviewing elderly patients, it revealed that many of them struggled with home measuring devices that required Bluetooth pairing, charging, PIN codes, and complex instructions, etc. For example, they needed a hub, so they were given a tablet that they needed to connect to. And that tablet, well, they were left at the bedside when they went downstairs to have a cup of coffee or a cup of tea, and they would be no longer monitored, and possibly also break the Bluetooth connection. Bluetooth connection in the first place and setting that up was complicated. They had difficulties doing the pairing, especially since they were already in pain or in discomfort and trying to just get better. And simple other things like not considering that some of the patients will also have arthritis, and this meant that the charger would get broken and they wouldn't be able to use the device at all. So, of course, design, we brainstorm. So we brainstorm concepts, different ideas, and this is where the Healthdot emerged. Instead of sticking directly to the design brief of making it easy to do Bluetooth pairing, charging, PIN code handling, and to provide clear instructions, a more radical concept emerged that turned this on its head. The patient should do nothing but focus on the recovery. To convince the project sponsors of the power of this radical approach, they created a story and captured it in film. They set up a hospital scene behind the scenes, also a home scenario, and created a couple of videos, including this one. So a patient at home starts breathing heavily. The Healthdot system detects this. A nurse observing the vitals remotely phones to check on the patient, has a short talk with the patient, and decides to send a home nurse to check up on the patient further. Quick short story that captures the essence and the simplicity of the idea. And this worked. The Healthdot team was created, a project was created to make the Healthdot. and included both clinical, a technical team, and business people to look at the proposition. So of course, one of the first things we looked at is the technical portion. Here you can see one of the first prototypes being worn in the garden, far from the hospital, and the data being sent to the cloud and being able to be observed from a distance. If you go to the Phillips Museum this week, you can actually see this prototype. It's also there on display. Next, also we had to check that it clinically would work in a real setting. So a clinical study was set up with Katerina, checking that it works in a real clinical setting, that it's giving clinically accurate data, and that works from both home and at the hospital. So that included 350 patients, also in and out of the corona period, and we were able to confirm that respiration measurements, heart rate are also accurate, and that we consistently get the data in. And further, we could also see that there are some clinically relevant trends that could detect some conditions early. The next step is after checking that it's technically feasible and starting to gather this clinical evidence that it works in real life, is to make sure that it actually meets the standards to become a medical device. The governing bodies want evidence of this, that medical devices should be safe and effective. As presented last year, there's more to usability than just ease of use. Usability includes making sure that it's safe and effective, and particularly that it prevents use errors or making mistakes. And this is particularly important for medical devices. So this includes from the patient side that we design, in essence, from humans. That means that it's effective because it works, it sends the data, they don't have to think about it. It's efficient because also they literally have to do nothing except for wear it. And from a satisfaction point of view, it's more about the form factor, the fact that it's small and unobtrusive and barely, if at all, noticed. The other side of the story is, of course, that it needs to work for healthcare professionals, doctors and nurses, and that the workflow around it makes sense. If it works for the patient but isn't usable for healthcare professionals or adds a lot of burden to the workload, it will not work. So we looked at each step, which include the activation, turning it on, applying it to the Healthdot to the patient, pairing it so that it will be visible in cloud, and then the future monitoring to make sure that all of these steps would work smoothly. So for the governing bodies, of course, we have to prove that the evidence is there, that we've checked that it's effective, efficient, and satisfactory, and also that clinicians know what they need to know about when you can use a Healthdot and what considerations you need to take into account. So last year, in Corona times, we were able to still do a test with nurses to check that the application and activation was simple and easy to use for them. We did this, of course, by including the right distance with masking. We observed them doing it with a mannequin, and we did this with at least 15 nurses. We also, of course, included some training to make sure that they would get the training they would normally get when they first encountered the Healthdot, but also time to forget, because typically, of course, you get training and then maybe it's a week later or possibly several weeks later before you actually have to use the product in real. We further checked about the understandability of the things you needed to know. And of course, this is more important for the doctors, but since this is really just about understandability, we could do this at a distance. So we did this purposely then on a distance. So we collected this evidence and came out that is effective, efficient, and satisfactory for the nurses and doctors as well, and that they understood what they needed to do. And one of the quotes that actually sort of underlines that for me is this. At first, I thought, oh, here we go again with such a gadget, but it actually speaks for itself. Because nurses are often confronted with new technology, new devices that they need to learn, and they're a hassle. But this device is not that. So there we go. We have the Healthdot, an unobtrusive, simple-looking device that monitors heart and respiration rate, connects directly to the cloud, and allows patients to recover from the comfort of their own home. What's next? The team is now busy working on bringing a new version to market so that we can have it across the world. Further, we're continuing to collaborate with Katarina to actually provide that clinical evidence that patients really can safely go home one day earlier. They're doing this with 200 bariatric patients and giving them the option, if they feel more comfortable to be in the hospital, to do the traditional pathway, or if they really want to be home in the comfort of their home, they have that option, and to compare whether there are complications, whether there's readmissions, and how it works in the real setting. And what's great about this is they're actually now considering broadening this beyond bariatric to other kinds of surgery options, and continuing to provide that clinical evidence that this is works in it real, so to convince physicians that they will be giving the standard of care that they really want to have. Healthdot. So of course I want to thank the Healthdot team again. This is some of them, you can see us before Corona times getting together. There are also some new additional team members that are not mentioned here for the NextGen, but I wanted to leave it here.
Wow, Jeroen, thank you very, very much for this super inspirational presentation. It's clear that Healthdot will make a huge difference for patients that are discharged from the hospital, enabling them to heal within the comfort of their homes. I would call that really liberating healthcare. Thank you so much. My name is Colette Forma. I'll be moderating the Q&A session with Jeroen. So we already have one question coming in, but I'm sure there will be many more. So I encourage you to share your questions in the Q&A panel, and we'll then look to answer them within the time frame we have. So let's then start with the first one. How did the team verify the sustainability of materials used? Or the suitability, suitability and the stickiness to the skin, Jeroen. Can you elaborate on this a little bit?
Okay, yeah, so that's an interesting question in terms of finding the right balance. We looked at different adhesives quite early on in the process to look at what was possible, how well they would stick to patients' skin, as well as whether they would cause irritation, because it's a balancing point with adhesives. You can have adhesives that give no irritation at all, but they will fall off in a day. Versus there are other adhesives that are meant to stay almost permanently, but they have the potential to have irritation. We wanted to have that sort of sweet spot that would allow for 14 days, because this covers many different conditions. So we found an adhesive. We did some testing with some participants to check, and we also used, of course, the knowledge we know from the provider of the materials, and there was very minor irritation at most, and no serious kind of side effects. So I was able to get an adhesive that would stay for the full 14 days, but allow for there to be comfort, basically.
Sounds good. So did you also look into reusing the device? Because I think after 2 weeks, what will happen with it?
Yeah, so yes, we did look at circularity or reusability. It's one of the things that is sort of currently future work, because there's electronics inside the device that can be reused, but it's more about setting up the infrastructure around that to be able to get devices back, and including that. So it's definitely something that they're looking at, particularly for the next version, but it's currently sort of future work.
All right. Talking about the next version, there is a question around the design improvements that you're planning to implement. Is there some feedback that has triggered those improvements? Can you say something about that already?
Yeah, so the next version, there are some things that we wanted to include some scenarios that are currently a little bit more difficult to handle. Because we want the patient not to have to do anything, to be able to truly support settings where the patient we send like a box with a sort of monitoring set to them, possibly including the Healthdot, to their house. We don't want them to have to bother with pairing and activation and all those kind of things. So we've gone in a direction to make the activation part even simpler than it currently is. So that, and the pairing can be done ahead of time so that when we have these kind of cases where we don't want the patient to come to hospital at all, they can just simply activate the device and go ahead with their business, and also just making it very clear for them how they need to apply it, because of course that's a new step for them. So that's really what focusing on that, beyond some technical things that we need to do for making a version that will work worldwide.
Interesting. Jeroen, could you give us an example of what data looks like that is sent to the hospital? So how often, for example, are data sent and analyzed?
Yeah, so in this version, in principle, it sends data every 5 minutes. And it sends heart and respiration rate data. These are two of the most important elements for detecting deterioration. So if a patient is potentially going to get sick from like a sepsis, which is like an infection, these are two of the most critical data points to follow. And so it's every 5 minutes that it sends data, and you can then see trends over time, and you can see whether the patient is slowly starting to deteriorate or not. It's not intended for patients with like the potential to have like serious heart attacks or like instant kind of reactions. That's a different kind of scenario where you really need the continuous, constant, second-by-second data. That's not what this Healthdot is in scope. This is really about seeing trends over time, because this is actually a big part of hospital stays. It's the first couple of days. Yeah, there's quite a high likelihood of, there's a chance of infections happening. If they're going to happen, they show up in those first few days. But there's always that gray zone between that and going to home, where yeah, theoretically it could still happen, but the chances are much lower. And that's really where the focus is on, is being able to allow that transition so patients can go home earlier and do so safely.
Yeah, I think that's why it would be really, really interesting, because that's also impacting cost, of course, of healthcare. So looking forward to this. Another question around the challenges you faced as a team when developing this solution. So as more specifically, someone is asking, is the solution always also working in countries where we may not have efficient services for monitoring?
Okay, that's an interesting question. This version, of course, was released in the Netherlands only. The worldwide scaling version is, of course, going to look at that as part of it. You do, of course, need to have some sort of infrastructure in place to allow for remote monitoring. That's an interesting question, whether you would do that from abroad, whether you would want to support from another country the healthcare, or whether you want to see if it makes sense in that kind of context. Of course, this is not going to be applicable everywhere, but where we have serious pressure on hospitals and there's the capability to monitor from a distance and the desire, it's definitely a good fit.
Sure, thanks. So I'm wondering, when we go back to the Netherlands and the research you're actually doing, you just told us a little bit about the data that is analyzed and also the time in between. What happens actually? So is that monitored all day long, and what happens when they see trends that are not going into the right direction?
Right. So we give some flexibility. It's not as I kind of hinted. It's not continuous monitoring 24/7. In that it's not every minute by minute, because that's more for heart attacks and those kind of conditions that are quite can instantly change. This is about trends. So it depends a little bit on what kind of patient and what kind of condition you're talking about. We give that flexibility. For some, it's sufficient just to monitor once a day, and that's enough to see a trend, to see whether they're going in the right direction or not. But also maybe just the first 2 or 3 days when they're at home, maybe you want to look at them more closely in those first couple of days. So nurses may look at it every 2 hours or every 4 hours to have a check-in. So they have sort of the flexibility to check whenever they want. And we leave it up to the hospitals currently to match to what they know, of course, because they know the conditions better than we do. What makes most sense for the patients that they're monitoring.
Mm-hmm. Okay. Talking about patients, what is the exact target audience for this device?
Yeah, okay. So if you're talking about patients, indeed, this is particularly for recovering from surgery, as we mentioned, is one of the main targets we have. It has also been used in part of a COVID kind of monitoring package. Of course, with COVID, we know that blood saturation is actually a more important indicator, but this can be an add-on to that to allow patients that are not sick enough to really need to go to the hospital to have at least a check earlier, to be monitored from a distance. So those are sort of two of the kind of groups we're looking at. But it's actually intended in terms of, you're purely talking about patients as humans. It's really talk about any kind of human. Of course, elderly are the ones who are having quite a lot of difficulty with the other options, with the Bluetooth pairing, with all the technical hurdles that were in other solutions. But this applies to all kinds of patients who really may just be in too much pain or just can't concentrate. And so the fact that they really don't need to do anything, but know that they're monitored, gives that peace of mind.
Indeed. So the device is activated within the hospital by clinicians or medical staff, and the patient doesn't need to do anything, just go home and recover.
Yeah.
Which is really, really cool, I think. How does data security work within the device? Is there a way for patients, for example, to control their data, or who has access to it?
Yeah, so I believe it's called it's end-to-end encryption secured. So the data is sent to the cloud through end-to-end subscription. So it's only from the device itself and at the endpoint, the monitoring location in the hospital that can see the data. Because even on the server, there's some levels of privacy so that we can't connect, see the data. So it already has that level, and yes, if patients do not want to be monitored, they can always opt out at some point. They have to do that by contacting the hospital, but then the hospital can turn it off and the data is no longer being received. Of course, the thing is with this is for a short period of time, up to 2 weeks. So if the patient doesn't want to have that, they will be asked ahead of time. And then they would stay in the hospital, most likely. So, and after that, we don't keep the data for extended period of time. It's only kept, I think, for 3 months, just in case they want to look at it. And beyond that, then it's already automatically deleted.
Yeah. Okay. Well, I think the comfort of getting home earlier might might solve that as well. Have you been thinking about integrating this technology into existing gadgets like Apple Watches or monitors for patients?
Yeah, so that's an interesting question, because people always wonder, why not a Fitbit, why not an Apple Watch? Those devices assume that you're connecting to Wi-Fi, you're connecting to your own smartphone. they're sort of a bridge to allow connection for different devices, which means if you're able to do that, you're probably in a better state of mind. Or you happen to be one of those tech-savvy people that's already, you're very familiar with it because you've already been playing with it before. The idea of this device is that you don't need those bridges. You don't need to connect with that. If in the future we wanted to add this data to a dashboard that would include the Apple Watch or something like that, of course we could consider that, but that's more about long-term trends of your health. This is really about taking care of yourself just after a procedure.
Yes. Talking about connection, is the sensor, can that also be connected to third-party platforms, or is it only Philips?
Yeah, so yeah, it goes through the Philips. It's a Philips cloud that it connects to, and then it connects currently to 2 different Philips platforms. However, it is possible through that API to connect to other platforms, but of course they need to be it's called a clinical management system. So a system that's going to be used in a hospital, because the people that should be seeing this data are medical professionals. So it's only going to be working with that. And so it would be a bit of work, but yeah, it's definitely possible to connect it. All
right, that's interesting. Jeroen, it's clear that you collaborated a lot with the Catharina Hospital. Can you elaborate a little bit on that collaboration?
Yeah, so indeed, the team definitely collaborated a lot with Catharina, and they were quite interested, particularly as the main case was this bariatric surgery. Bariatric is a sort of a prime example of where you're looking at just trying to prevent sepsis, so the deterioration of patients. And it just makes a lot of sense to be able to have patients go home early when in many cases there's not going to be a problem, but you want to be able to do it safely. So the hospital is really keen on this option and looking at this and being one of the first to be able to do this properly. So they're quite keen on that, and they're quite interested in the possibilities of extending it to other surgeries and just being one of those locations where you really have that flexibility and give patients yeah, the option to have the care that they want.
Cool. Looking at some more questions. Did you, in your research, observe any issues with patients being concerned to know that the device is working? So do they have enough confidence that they are really monitored while being at home?
Yeah, so I would need to double check with the clinical data, but from what I understand, there was a lot of trust in that. Of course, they always have the option of phoning. We asked if you didn't feel well, if you're not, if you really think yourself that you're not doing well, you could phone in and check in with the team that's monitoring you. But the concept is really you don't need to worry about it because it's yeah, it's working. So yeah, it's interesting because it doesn't have any indication it's working, but it just does. So, but I don't think we actually got that remark from participants. I would need to double check.
Okay. And talking about the medical staff, so somebody in the audience is wondering if medical staff at hospitals will be able to pay enough attention to recovering patients while they're at home. So did this come up? That's the question. Did this come up during your design phase? And is there a consideration that you took into account in the design?
Yeah, so indeed, this is monitoring patients from home, from the hospital at home, I mean, is a change to workflow. Because currently they have, on a ward, they'll have a central station where they will monitor from that central station many different beds in the ward. If they see something on that central station, then they will go and check on a patient. So in that sense, it's familiar to ward nurses.
Mm-hmm.
So they, from a central station, it just the difference is instead of going to look at the patient in person, they would phone the patient. So in that kind of sense, it could fit into that kind of workflow where they have a central station. Of course, the alternative is that you have a dedicated group that is doing the monitoring of patients at home, to give an option so that the nurses at the hospital focus more on the patients that are in the hospital themselves.
Yeah, that sounds quite logical. So it also has to do with the choices that are being made in the hospital, how to organize for this.
Yes, indeed. So it's not that we're dictating, but yeah, of course, we considered these questions and thought about, yeah, well, these are kind of sort of the two main pathways, but it's a little bit of a sorting out and collaboration with different hospitals, which ways they want to try and go ahead with.
Can we dive a little bit into potential safety problems that you anticipated and that you found and anticipated on while developing this device?
Right. So one of a big thing that still happens occasionally is patient mix-up. That patient's data is not sent, it's not connected to the right patient. So what was very important is that the pairing, when you're doing the pairing, that you pair the patient you're taking care of to the Healthdot that's getting applied to them. So we specifically included that in the design of the pairing app, that the very first step is to scan the patient. And because you need to scan the sort of the wristband with the patient ID, you will literally be at the patient's side when you're doing it, making it much more probable that you're going to connect and place pair the Healthdot on the right patient. So that was a very explicit design choice to make sure that everything happens right when you're next to the patient, to avoid that safety concern.
Mm-hmm. Cool. Jeroen, there is also a question around the time frame from project initiation to actually where you're currently in the project.
Yeah, so that's an interesting question in terms of the medical device world is quite different from consumer products in that there's a much longer time span needed. So this is already over several years, this process. Because first the idea was, we came up with the challenge with the design brief, then they needed to check that technically it was possible. It was done with a very small team. But then, yeah, then the next step was really to make it a medical device, and it was new to that team. And so I was part of the team and teaching them about how that, at least from a usability perspective, works to make it a real medical product. And yeah, that's just stepping it through, doing the risk analysis, doing the checks on the workflow, especially the workflow for nurses and doctors, to look at all of that and make sure that you're covering all your bases, and then to do the testing and provide the evidence. So that took, another, I think at least another year, and particularly also because that was over COVID time, which had its own challenges, but we were able to do that as well. Yeah.
And I think it's really cool, and maybe you want to elaborate a little bit. You mentioned that that this is a project that really started in design, which is not always the case. So tell us a little bit more, if there is.
Yeah, so indeed, it was kind of a great concept. We really challenged us at the design brief. And because of that, that meant we were able to take this concept that a patient really shouldn't be doing anything, just recovering from their illness. We took that, we were able to do as I mentioned, the project team, try out the technology, make it really, do their investigations to make something that's small, but still is able to do this data collection. and be able to communicate to the cloud without having to need any hub. To eventually that meaning that taking that the core design team actually switched over, and some of them became part of the Healthdot team and are leading the venture now. And taking that, so a designer actually left from design and became part of the venture because they really believe in the concept, and have been moving it forward and collaborating with the hospitals and taking it to the next level.
That's really, really nice to hear. I could imagine also because, I mean, it's obvious that a lot of ventures don't make it. So it must have been a great moment for the team as well to realize that this was really flying.
Mm-hmm.
Cool. Let me see, another question just coming in. Is the Healthdot replacing another earlier Philips biosensor that was already there?
Yeah, that's an interesting question. There were some other solutions in the Philips, and there are some other solutions that are targeted at a little bit different element. But basically, they didn't fit this user need to really be able to switch from hospital to home quickly. A lot of sensors are more suited for in-hospital monitoring, with some transition to be able to, like, for very specific conditions where you need, like as I mentioned, higher resolution on the heart rate.
Okay, I think we more or less have answered the questions in the chat box. Is there anything you would still like to tell us about the nuances about this project or development? Is there something you didn't mention that would be valuable to share?
Yeah, okay. So it's a deceptively simple looking device. As a usability designer, I actually kind of like that it's not about being flashy, not about being so in your face. It's really a device that just sort of disappears into the background. And that is actually sort of fundamentally what I think is great usability design. It is a system or a device that you can do what you want to do. You can focus on what's important, and whatever you make supports you in doing that. And the fact that we're able to do that from the core of this concept, I think is just really powerful.
To that happy note, I think, that's a great final. If there are no more questions, and Jeroen, you told us everything you want to share, then I think we can round it off here.
All right, sounds good.
So if you click the next slide, if you, as a listener, are keen on exploring opportunities in Philips Experience Design and becoming Jeroen's colleague, then simply scan the code, and then you can have a look into our roles and also be part of the talent pool. Then, Jeroen, thank you very, very much for sharing all your knowledge about Healthdot. I think it was a great starting point for 8 design talks that we still have this week for the Dutch Design Week. So if you still want to explore more of those talks, be more than welcome to subscribe as well for the other talks. And Jeroen, thank you so much for being here and kicking it off. Looking forward to the next ones, and see you all soon.